We're going to continue on the journey of trying this theoretical idea of optimizing strain to facilitate healing. And I'm going to focus primarily around the use of a ring fixator in this concept. This is all now case-based, okay? We're not going to sit here with our theoretical hats on, because ultimately we're all surgeons. So what do I do in the operating theatre when I'm fixing a fracture with a frame that I think about in terms of the mechanical construct of what I'm trying to achieve? i.e., what's the stuff you're really going to remember out of all of this when you're in the nitty-gritty of doing an operation and you've got all those other things in your head going on, the consent, the drapes, the sterilization, the trainee next to you, the scrub nurse that doesn't know what you're not going to remember the amazing formula over 2 over E in the distance at a drop of a hat. So what is it that we're going to do at a practical basis in the lab? And I'm not taking anything away, because I love your formula. I think that's awesome, but it's a hard thing to remember on a daily basis and apply locally. So let's just remember the really simple stuff, okay? Plates and monolateral pin-to-bar type fixators are off axis. Let's stay on the tibia. The tibia is a nice, easy working example here. Okay, so the fixation is biased to one side of the axis of the bone, and that means it's loaded in cantilever fashion. Nails and frames are built circumferentially around the axis of the bone, so they are beam loaded, i.e. much more evenly loaded, okay? That's a really important thing for us to remember, but it's a simple thing to remember in the OR. And in our frame, the beams are the wires, not the rings, okay? The rings are simply the fixation point for our beams. So in reality, what does that translate to? Well, when I fix fractures, and I was very much an Ilizarov-trained fellow, so rather than a hexapod or a Taylor spatial, I learned traditional Ilizarov framing from David in Chertsey and then up in Liverpool as well. And so that formed the basis for my primary construct design when I fix an acute fracture with a frame. So here we go, this is like a low-hanging fruit for a frame, right? Open, 3A open, segmental tibial fracture. It's crying out for a frame. You can nail it as well if you like, but we chose to frame it. And there's no tricks, there's no surprises. I use the frame to align the limb top and bottom. I use the frame to help reduce the oblique plane here, so we've used 2 counter olives to reduce the fracture at that level. And I've built a frame that essentially has 2 rings, each with 2 fixation elements to each segment of bone. So we've got 3 primary segments of bone. Each one has 2 rings on it. Each ring has 2 wires on it. It is as simple a frame as you can get. But the beauty of this frame is if you stick true to that with good crossing angles, good wire handling techniques, you get an isotropic frame. That frame behaves as close as it can, the same in whichever direction it's loaded. And the self-tensioning properties of the wires allow us to get that really good, even callus formation and a good, predictable bit of fracture healing. And lo and behold, a matter of 4 months or so later, the frame comes off, he's beautifully aligned, and it's the simplest method of all. So an all-wire fixation construct with a ring fixator, and there's got to be something good in there in terms of the mechanics as well as the biological preservation that it gives us. If we look at a periarticular fracture, we're challenged a little bit more at the metaphyseal end of the bone in terms of real estate for holding on to stuff. Okay, that's the challenge. So here we go, another one, a 32-year-old man. This guy was actually on his own stag weekend and jumped off a wall and ended up in hospital and having to have a frame for his wedding day. These things happen. But he has a pretty bad pilon fracture with a significant metaphyseal extension. You can see it here, but the articular block's relatively straightforward. And this is a standard, again, frame construct for me, which is we've heard it. If you go back to the plating diagrams, essentially we've got near-far fixation on the shaft with our proximal 2 rings. We've got a metaphyseal ring. Usually I go for 3 or 4 wires on the metaphysis. In this instance, we've spanned the joint to include the foot. There are different schools of thought around crossing joints in periarticular fractures with framing. But broadly speaking, we've gone again with an all-wire construct. It gives us circumferentially symmetrical callus formation, even loading, and predictable. Okay? So that's what I learned on my fellowships, and that's how I started off doing frames about 10 years ago now, and they work. Brilliant. Then what happens about 2 or 3 or 4 years into your practice as a consultant is you start to put on your cloak of invincibility. You think you're able to save the world and treat everything. And simultaneously to thinking you're amazing, you open up this box of new toys and stuff comes along and you start to do things because you've been to conferences and seen stuff happen, or industry come and tell you about the latest whiz-bang product. And the first thing that happens is you start experimenting. I started experimenting with adding half pins into frames. I went to the States. I saw some pictures of these amazing 2-ring stacked TSF frames with a couple of half pins each side and these tibias that were just healing, of course, immediately. And I was like, wow, I must try this. And so we got to go back and remember, what is the impact of adding a half pin into your construct in a wire fixator? And there are some really important things that you need to remember about this. So on the left there is our typical all-wire fixator. Here we've got a combined, what we could call a hybrid in terms of fixation, i.e. it's an all-ring fixator, but a mixture of half pins and wires. And then here we've got the sort of true hybrid, which is a mixture of a pin-to-bar construct at one end and a ring fixator construct at the other. And these have a massively different mechanical property when it comes to fracture healing. This slide is really telling, which is, if you look at the left side, up the vertical axis is the amount of gapping that is occurring at a fracture for a given load. Here we've got a Smith & Nephew Ilizarov 8-wire construct. So this is essentially a 4-ring frame with 2 wires on each ring, okay? And for a given load, we get very little displacement. As soon as you take a Smith & Nephew Ilizarov 4-ring frame, and it's 4 wires, 4 pins, okay? So we've basically said, I'm going to add a half pin on each ring. We get the, there we go. Oh, there we go, up at the top, my bad. Up here, we've got a much bigger degree of gapping, of movement for the same given load. So something has happened to the way your frame behaves the minute you drop a half pin into it. Does it matter? Yeah, so here we go, another case. Here's my man. This guy, he walked across the A3, which is one of our sort of high-speed roads down south. Like most motorways or dual carriageways, it doesn't really have many pedestrian crossings. And lo and behold, he has a pretty bad high-energy open tibia. And I frame it. He's got segmental fracture, he's got a distal segment, he's got a proximal segment, he's got a huge zone of comminution. It's crying out for a frame. I've added some screws to the tuberosity. But what I have done is drop in a cheeky half pin here. And that meant, I thought in my head, oh, I can get away with fewer rings, maybe make the frame a bit lighter, a bit easier to manage. So I've got 2 rings on my proximal segment. I've kind of got a ring on the middle-ish bit, but it's primarily really just offering a wire to reduce that fragment. Then there's a very long distance, and I've got a ring and a drop pin. And it looks to have healed, but it hasn't healed, and this goes on to a non-union. Now, it may have gone on to a non-union because the man's been hit by a car at 70 miles an hour, exploded his tibia, but the callus formation is asymmetric, and the half pin on the side where the half pin was, like almost if you imagine under the plate, which is what a half pin behaves like, we see very little callus formation. So for me, the half pins, they feel good when you put them in. They give you that confidence that you must be holding the bone well, but they do something mischievous to the mechanics in a frame. Similarly, then we go to a hybrid type fixator. So we've got that sort of periarticular ring at the top. We've got a sort of really uniplanar fixation distally, and lo and behold, funnily enough, the thing doesn't heal. Okay, so we've got to remember that there must be something in the mechanics of an all-wire construct that is favorable. The next new toy that comes along, and we think is awesome, and Alex, I do think it's awesome, by the way, I love it, okay, the hexapod. And this is an incredibly powerful tool, but boy, oh boy, does it play with the mechanics of fracture fixation, okay? And there is absolutely a need for you to understand the importance of what happens to the mechanical environment at a fracture site when you have a hexapod in use. So here we go. Man falls from height, typical, another periarticular fracture, the usual stuff, and I go all American. I go all out American, and I go a single ring distally on the joint. I go a single ring proximally with a couple of half pins, maybe a wire as well for a reference, but it must heal because I saw it at a conference that a 2-ring stack for periarticular trauma, and it got to heal, right? That's what they'll tell us. Alex, you agree? That's what we're told. That's what we're sold, right? That's how these work. And he goes on, oh, look, it's sort of making a bit of cheeky callus at the fracture site. It's sort of stayed aligned. And then, oh dear, no, it hasn't. And the whole thing's fallen apart. And that's because mechanically, this is not behaving in a favorable way for our fracture healing. Very long working distance, very stiff and rigid in an asymmetric fashion proximally, doesn't offer enough isotropic behavior in terms of that frame, so it behaves differently depending on which way it's loaded, and I think we don't understand enough. The other thing is that 6 oblique struts behave very differently to 4 vertical struts in terms of their resistance to axial motion, rotational motion, and shear. So, I'm going to keep this really simple. When do I use an all-wire frame? When might I use a half pin? And when might I use a hexapod? I have gone back to essentially an all-wire, genuine, true Elizarov frame for acute fractures. If the leg is wobbly, I can make the leg straight inside a straight frame, every time, okay? You don't need a hexapod in an acute fracture, as far as I'm concerned, and I've gone back to all-wire frames, and this is my clinic this week. On the left is a plateau, so we've got a periarticular ring at the top with 4 wires. I've got a little extra ring just for the metaphyseal stuff up at the metaphyseal. That's just got 1 additional wire. Then there's a ring here with a couple of wires and a ring here with a couple of wires. So that is my standard periarticular frame for a plateau. And lo and behold, here's a pilon, exactly the same frame but upside down, periarticular ring with 4 wires, then a near far on the shaft side, 2 wires on each. And that is my standard frame for an acute fracture, and my frame time has come right down. And the frames are coming off now at 4 months, 4.5 months for acute fractures, because I think you get really even callus formation, a bouncy frame. It's nothing I've invented, it's nothing new. I've just gone back to the fundamental principles of Elizarov surgery. So for me, in an acute fracture, that's my construct. If I'm going to use a half pin, when would I use a half pin? If I'm moving bone. If I'm moving bone, I'm going to add a half pin. So a classic example would be in a bone transport or something like that. Here we go. This guy's 28. He was working on a building site. There's an auger, those huge corkscrews that dig the foundations into the ground, and his leg got caught in one of those, so he got half dragged into the ground with his leg going in it. Then they had to reverse it. Then they pulled his leg out. Then he comes to us, and we have a high-energy comminuted fracture. He gets a debridement, a standard pin-to-bar X-fix on day 1 with a flap. We wait for it all to heal. We've acutely shortened and docked the fracture site, and then he gets a frame at day 21. And again, it's pretty much all wire, but because this is going to be the moving segment of bone, the transport segment, I'm going to put a half pin here, and I'm going to put a half pin in the short segment at the top to prevent displacement and movement. When you're moving bone, if you're on all wires, you will get deflection of the wire, and therefore you'll lose some of the predictable movement of your bone. So I like the half pins to avoid that. And he goes on through bone transport, to heal, again in a very predictable fashion. And we've only used just enough half pins to allow us to control the moving segment of bone very specifically. When do I use a hexapod? Generally, nowadays, if I'm doing something gradual or something with a complex multiplanar deformity where it becomes a lot easier than building lots of complex individual hinges. So here, in context of fracture healing, here we're going to see some of the real value of the movement in a frame over the duration. And the gentleman here was asking about reverse dynamization, and what you can see here is almost some of that at work. Here's a typical non-union, okay? Relatively simple fracture line, a little bit of comminution, relatively simple, locked both sides of the construct, malaligned, malreduced, and predictably, therefore, doesn't heal. Diabetic, vasculopathic as well, so it's percutaneous hardware removal and a frame for me. There are other ways to treat this, but I'm just using this as an example. Here, I use a hexapod because we put the frame on. We can do that minimally invasively. I've gone pretty much all wire on one side, and actually, I think it's an all wire hexapod, but we're using the hexapod to realign him, and then we're using distraction to increase the tension and therefore reduce the strain at the fracture site. And that closed distraction of a non-union allows us not only to facilitate the realignment, which we've used with the software and the program, so you can see the frame is now slightly bent, but it also gives us that increased tension in the soft tissues, and therefore it heals. And you can see again the symmetrical callus formation that has occurred as opposed to the asymmetric callus you would get with a frame. So that looks like the same callus ball you'd get with a nail down the middle, right? It's symmetrical because we've got that evenly loaded frame. And here we go, frame comes off and he's healed. So that is my really simplistic approach to how I manipulate the strain environment with a frame. Remember the fundamental principles, and I know Bob said he doesn't like principles, but principles in terms of the mechanics of beam and cantilever, those are principles. Beams beat cantilevers, right? If it's like rock, paper, scissors, beams, cantilevers, I don't know, something else, beams always win. That's my view on it. And Mr. Elizarov definitely knew what he was talking about when it came to fine wire fixators. And so I have gone back for acute fractures to traditional all-wire Elizarov frames, and I promise you, you will reduce your frame time, you will reduce your pin site complication rate because the tension in the construct is much more even across the whole leg. The patients mobilize better and quicker, and I've seen a dramatic change in the way the patients are compared to when I've tried to use half pins and hexapods for fresh fracture fixation. Thank you.